Hello and welcome to the channel. In this video we are going to discuss about the diabetic ketoacidosis. What happen in diabetic ketoacidosis? Ketones are a form of acids. In diabetic ketoacidosis, these ketones build up in the body, causing increased acid levels in the blood. It happens when your body sugar level stays high for longer duration. This is a serious complication of diabetes and can be fatal, but it takes some time to develop, so that there is a chance to treat it, and most importantly, it can be prevented. Symptoms of diabetic ketoacidosis. In diabetic ketoacidosis, symptoms appear quickly, and it may be the first warning sign that you have diabetes. First, let's look at some symptoms which occur due to diabetes. Dry mouth, dry skin, feeling of thirst, frequent urination, nausea and vomiting, weakness, fatigue, altered consciousness or confusion, flushed face, headache, muscle ache, ketonic breath, abdominal pain, shortness of breath. If you have home kit to measure ketones and it shows that your ketone levels are moderate to high, or your blood glucose level is very high, or you have following symptoms, you should rush into your doctor or emergency medical unit near to you. Vomiting for more than 2 hours. Abdominal pain or discomfort. Fruity smell aka ketonic breath. Fatigue, confused or altered consciousness. Difficulty in breathing. Causes for diabetic ketoacidosis. Diabetic ketoacidosis happens because your body can't utilize glucose due to lack of insulin or lack of action of insulin. Instead, body now utilize fat for energy production. Fat metabolism produce ketones as an end product of metabolism. If this process goes on, ketones build up in your blood. Excess acids or ketones interfere with the chemical balance of your body, giving rise to those symptoms that I mentioned earlier. Risk factors for diabetic ketoacidosis. Diabetes mellitus type 1. These patients can't produce insulin at all, so they are at high risk of developing diabetic ketoacidosis. They can develop diabetic ketoacidosis if they skip a meal, have other illness or stress, in insulin reaction, haven't injected enough dose. Patient with type 2 diabetes can also develop diabetic ketoacidosis, but it is rare. They are more prone to have hyperosmolar hyperglycemic non-ketonic acidosis, where you may have the same sort of symptoms. Missing insulin more frequently or not taking insulin as prescribed. Any gastrointestinal illness, infections, heart disease, recent strokes, surgery, pulmonary thromboembolism, any trauma, pregnancy, steroids or antipsychotics, illegal drugs such as cocaine. Diagnosis and tests. Check your ketone levels. If your blood sugar level is over 250 mg per dl, or you have symptoms that I have mentioned previously, you can use either urine test strips or glucose meter. Your doctor can order following investigations: blood work, metabolic panel and electrolytes, urine report, arterial blood gas analysis, blood pressure, investigations for infections as needed, chest X-ray, ECG. Treatment for diabetic ketoacidosis. Diabetic ketoacidosis should be treated immediately. If not, you can progress to coma and possibly die. Intravenous insulin to lower the blood glucose levels and ketone levels. IV fluids to keep you hydrated. IV electrolytes such as sodium, potassium, and chloride to maintain the electrolytes balance. Antibiotics if there is any infection. If any cardiac problem identified, further treatments. Diabetic ketoacidosis complications. If diabetic ketoacidosis not treated immediately, there may be some complications: hypoglycemia, hypokalemia, cerebral edema, loss of consciousness, death. Prevention of diabetic ketoacidosis. Only thing matters is good glycemic control. You should manage your glucose levels through your diet, exercises, and medications. Drink lots of water or sugar-free non-alcoholic beverages. Take medicine as directed. Don't skip meals. Regular exercises. Test blood glucose levels regularly. Check the expire date of insulin. Before injecting, look for any clumps in the vial. See whether your insulin pen is leaking. Regular clinical follow-up. Be ready for an emergency, have a plan in mind. That's it for this video. Thank you for watching. Subscribe for more valuable videos. Goodbye until next time. Stay safe and peace.
Artificial love, we just make it up.